Hello, Mr. Brown. My name's Miranda. I'm going to be your nurse today. I'm going to be inspecting your abdomen, auscultating, and palpating. I'm going to raise your shirt. It's about the lower part of your ribs. I'm going to look at your abdomen. I'm going to inspect it for color, make sure there's no bluing, which could determine if there was any trauma or internal bleeding. I'm also going to look for any stretch marks. I'm also going to look for any old scars or new scars, and if you had any scars, I then ask you how long have you had it, and I'll look for if it's healed or if there's any redness, which could be an infection. I'm also going to look for any lesions or rashes, and I'm also going to look at the shape of your stomach, which I'm going to look at level with you to make sure it's flat or if it's round or if it's distended. Now I'm going to auscultate and listen to your bowel sounds. I'm going to start at the right lower quadrant and work around clockwise. Normal bowel sounds should occur between 5 and 15 seconds. To determine absent bowel sounds, you would need to listen for approximately 5 minutes. To auscultate vascular sound, we listen to the abdominal aorta and the renal arteries. We listen for a bruit, and you use the bell of your stethoscope. Next, Mr. Brown, we're going to palpate your abdomen. First, I'm going to palpate lightly from the right lower quadrant all the way around counterclockwise. I'm going to do a light palpation. Let me know if it hurts. Any tenderness? No. Now I'm going to do a deep palpation, and this is used to check if there's any masses or inflammation. And this could tell if there's by any tenderness or pain. If there's trauma or tumors, infection, peritonitis, and large or diseased organs. Next, I'm going to do rebound tenderness, and this is by palpating deeply at 90 degrees, then I'm going to release rapidly. I'm going to listen and watch my patient to see if he has any pain from his expression. Does that hurt?
Tickle.
Next, Mr. Brown, we're going to do percussion. By percussing the abdomen clockwise and tapping on my middle finger, I'm going to listen for tympany, and this will be heard due to air in the stomach or the intestines. I will use my non-dominant hand. Dull noises can be heard if there's any fluid or masses. Hyperresonance can be heard from any distension. In the right upper quadrant, I will percuss for the liver. Normal liver span is about 6 to 12 centimeters at the mid-clavicular line. I'm going to begin right here and percuss until the sound changes from tympany to dull. We have found the lower level of the liver. Now I'm going to percuss from the top and find the top of the liver. We found the top of the liver border. Next, we are going to check for the spleen. The spleen is located in the left upper quadrant at the mid-axillary line from the 9th to 12th intercostal space. I'm going to palpate and also percuss to feel for the spleen. Any pain? Mr. Brown, could you please sit up for me? Now I'm going to check his kidneys. I'm going to see if there's any tenderness or inflammation. I'm going to be using my non-dominant hand to percuss your liver. and this is located at the bottom of his ribs. If you feel any pain or tenderness, please let me know. Any pain or tenderness?
None.
Okay, Mr. Brown, could you please lay back for me? I did not note any discoloration, abnormal abdominal sounds, or bowel sounds, and there was no pain during palpitation. This will end my abdominal assessment.